Hello, everyone, and welcome back to Mindful Moments, the podcast where we explore mental health with compassion and clarity. I'm your host, Samara, and today we're diving into a topic that many people experience but rarely discuss openly: bipolar anger. What does bipolar anger actually feel like, and how is it different from everyday frustration? To help us unpack this, I'm so grateful to be joined by clinical psychologist and author Dr. Laura Athey. Dr. Laura, welcome.
Thank you, Samara. It's a pleasure to be here.
Dr. Laura, in your article, What Does Bipolar Anger Feel Like?, you mentioned that anger is often the most misunderstood symptom of bipolar disorder. Can you help our listeners understand what's really happening beneath the surface?
Absolutely. First, it's vital to clarify. Bipolar disorder is episodic, not a personality trait. When someone experiences bipolar anger, it's not about being an angry person. It's about neurochemistry. During manic or mixed episodes, the brain floods with dopamine and norepinephrine. This puts the nervous system into overdrive. So when something blocks that intense internal momentum, even a small inconvenience, the brain can react with immediate, overwhelming hostility. And I want your listeners to hear this. That guilt you feel after an outburst, that shame, it doesn't mean you're broken. It means you're human, navigating a medical condition.
That's so important. You also draw a clear distinction between normal anger and bipolar-related anger. Could you walk us through that?
Of course. Normal anger is usually proportional. It matches the trigger. You get cut off in traffic, you feel frustrated, it passes. Bipolar anger? It's state-dependent. The trigger might be tiny, a comment, a misplaced key, but the reaction is intense, disproportionate, and can last hours or even days. Why? Because during an episode, the prefrontal cortex, the brain's brake pedal, loses its ability to regulate the amygdala, the emotional alarm system.
So it's not about willpower, it's biology.
Exactly. And that's why Dr. Laura always emphasizes sleep hygiene with patients. Even losing a few hours of sleep can destabilize circadian rhythms, suppress that regulatory prefrontal cortex, and flip the irritability switch to on.
For listeners who might be experiencing this, or supporting someone who is, what are actionable steps to manage bipolar anger in the moment?
3 things. First, pause and remove stimulation. Step into a quiet, dim space. Your nervous system can't process more input right now. Second, ground your body. Try paced breathing. Inhale for 4, exhale for 6. Lengthening the exhale signals safety to your brain. Third, have a pre-agreed safety plan. With loved ones, choose a safe word that means, "I need space, no questions, no arguments." And remember, recovery isn't linear. But with consistent sleep, medication if prescribed, and therapies like IPSRT, interpersonal and social rhythm therapy, episodes become less frequent, less intense. You are not your anger.
Thank you, Dr. Laura. That message of hope and science is exactly what our community needs. Before we close, is there one final thought you'd like to leave with your listeners?
Yes. If you recognize these patterns in yourself, please reach out. A self-test can be a starting point, but a professional evaluation is the next step. You deserve support. And if you're supporting someone, validate their feelings without escalating the moment. Say, "I see you're upset. We'll talk when it's calmer." Boundaries protect everyone.
Powerful wisdom from Dr. Laura Athey, clinical psychologist and author of today's featured article. If this conversation resonated with you, please do us a huge favor. Like this episode and subscribe to Mindful Moments. Your support helps us bring more compassionate, evidence-based conversations to listeners around the world. Until next time, be kind to your mind and to each other. I'm Samara.
And I'm Dr. Laura. Take care.